So that's the first thing to notice is the pericardium, right? This is the fibrous pericardium, right? So I'll be cutting through that. You can see fat. That's the apex of the heart. The base is the left atrium. All right, the first thing that you want to be able to do, of course, is identify the anterior surface of the heart. And the apex generally is tilted toward the left. Okay, so that tells you, I would say, I'm thinking this is the anterior surface. So that means, let's see what this, I may be wrong. Yeah. Okay, the best thing is to remove the pericardium. That makes things a lot easier. Because then you can actually see, you can see roughly where the interventricular sulcus is. So it's filled with fat. But you can see the fat, like a fatty ridge. Instead of a groove, you actually see a ridge. So, of course, this is the parietal layer, right? The visceral layer is actually, right, this is the visceral layer of the pericardium. But see that you can begin to see the anterior interventricular sulcus already. It's gonna. Okay, see, that really does help because you can see the groove here. Actually, there's not much fat in this one. Right, that's the anterior interventricular sulcus. So right away that tells you that this is a ventricle and this is another ventricle. This is the right ventricle. And look at scissors. So can you guess what these are here? This here.
The auricles.
Auricle. So that's an auricle. Here's another auricle, right? So this, of course, would be the left auricle, right auricle, and now you can see the blood vessel that I was looking for.
Isn't that the opposite way?
I don't know. Want to bet? Anyone make a $10 bet with me? Is that a $10 bet we have going there, Alma?
You said the one by your right hand is the right and it's the left.
Did I?
Yes.
You did.
Oh, I said,
You
oh
owe me
my God,
$10.
I owe you $10. That's the left auricle, that's the right auricle. Uh-oh. That was bad. Okay. That was pretty bad. Okay. I was just checking. Isn't that what we always say? Okay, so what do you think this here is?
Pulmonary trunk.
Good. So this is what I'm targeting, right? I want to stick the probe into the pulmonary trunk, right? And I'm going to run it pretty much down the middle. I don't want to cut too close, right? So what's going to be, what would you think is just deep to this here? The interventricular septum, right? So I don't want to get too close to that. All right, so now you have to find the opening, or I have to find the opening to the pulmonary trunk. I think this is it. Yeah. See? It's kind of tricky, right? So you see that opening there? Of course, there's another one here, and there's this one, and then there's this one, and then there's this opening. So you kind of wonder, well, which one is it? But anyway, so that's it there. So right now, at this point, what do you think I'm about to go through?
Pulmonary section.
Yes.
Into the ventricle.
Yes.
Right ventricle.
And this is, you have to be careful because with the scissors, I think I'm gonna try another scalpel. You can actually dig into the posterior wall of the ventricle, and I've done that. So even if the scalpel looks worse, it's probably not, actually. Let's see. No, I didn't dig too deep this time. Yes, that's good. That's very good. Yeah, I think even if the scissors, you might think that you have more control with the scissors. But see, I was digging a little bit into the wall, see, with the scissors. All right. Now here I need somebody with,
Gloves.
well, yeah. So I need somebody to hold this here. Thanks. Okay. Wait. You know what? Can she let her come over this way, please? Okay. And even further. Thanks. All right. Okay. So what I want to show you is really small. You're gonna. Yeah, I think you might need to use both hands. Yeah. Thanks. See this here? This little membrane here. That's that's one of the cusps. So there's 3 cusps. Of course, I cut through one. Here's a cusp. See that? That's a cut. See that cusp?
Mm-hmm.
I guess I cut through this one, and there should be another one. Anyway, these are the cusps. That's all there is
Of the
to
semilunar valve?
to the pulmonary semilunar valve. That's right. Okay, that's good. Thanks. All right. Now there's a blood clot in there. See that blood clot?
Where?
Okay. Anyway. So I'm going to stick this through in order to find, what do you think I want to find?
Descending.
The superior vena caves.
Yes.
Coming up.
No, it's not. Should be this. Anyway, see how thin those walls are? That's a vein. This is an artery here. See that? See how thick that is? That's an artery. This is an artery. Okay. I did not find it. Okay, we're going back here. Try again. Cut a little bit further. It's just a blood clot. You see what you're looking at there? That's looking up into the, you can't see it, but into the right atrium. Okay, once again, I need somebody to hold where I have these 2 fingers. You have to grab that kind of forcefully, pretty forcefully. You try to, there, that's good. See this here? That's a cusp, right? This is chordae tendineae, see? Chordae tendineae. Let me change hands.
So is the tricuspid.
Yeah, that's the tricuspid valve. It's just very slippery. Yeah, just go ahead and use your fingers really hard. Anyway, so that's a cusp. You can see another cusp here. This is chordae tendineae. So that, okay, so you can let go. So see the this is a papillary muscle here. See? With the chordae tendineae attached to it, that's a papillary muscle. How many should there be here?
3.
Right. Okay, you can see more here, right? See this? This is, it just slips. What? More chordae tendineae here. So here's another papillary muscle. Chordae tendineae, okay? So I'm sticking the probe through the tricuspid. Let's see where it's going to. The thing is that it can just poke right through the wall. It doesn't necessarily come out through. It's just really tight. Just not cooperating at all. You know, where's it going to come out? That's not right. It's not coming out in the right place at all. Alright, I'm gonna go this way then. I thought I already tried that and it didn't work either. Well, I'm just gonna risk it. Okay. I'll just cut this one. I won't bother finding that. What I don't like here is that I end up having to damage the tricuspid. There's just no way around it. That's the coronary sinus. Anyway, the posterior surface of the heart, this is something I didn't show you, but the posterior surface of the heart, see this groove? This is still part of the coronary sulcus here, okay? And there's a blood vessel, there's another blood vessel that travels here, and that's the coronary sinus. It's a vein. About 90% of the venous blood of the heart empties into the sinus. And the coronary sinus, if you remember, is one of the 3 blood vessels that drains into the right atrium, right? So there's the superior and inferior vena cavas and the coronary sinus. Drains into the right atrium. So this is right here, this is probably the superior vena cava. It's very thin. I'm not seeing it yet. Is that it? Okay. I'm going to cut off some of the wall to the, well, maybe I don't need to. Anyway, here you're seeing more of the right ventricle, okay? You don't see that much trabeculae carni here, except for